Welcome back. This hour will take you to this briefing where government, through social protection, community and human development clusters, is hosting a joint media briefing to respond and clarify the implications of the findings of the research study on sanitary pads. I understand now the Minister of Health, Dr. Motsoaledi, now on the podium. Let's take you there.
He is the President and CEO of our prime research organization, the South African Medical Research Council. He could not be with us today because he's in Cape Town, but he's logged in there. I also want to give a special welcome to the President of South African Society of Obstetricians and Gynecologists, President Ismail Borat. He's also with another member of South African Society of Gynecologists, Professor Zozonene. They are also logged in on the screen there. The Chief Regulation Officer of the SAHPRA, South African Health Product Regulatory Authority, is also on the screen because Dr. Simete, who was with us yesterday in preparations, could not make it. On the screen, we also have Dr. Richard Brown, who is the head of chemicals and radiation at the World Health Organization. He has logged in from Geneva, but I'm sure you are aware that the WHO is represented here today. So I also wish to welcome officials from the regulatory authorities. We have got in our midst Mr. Hadin Nadishan, who is representing, who is the acting commissioner of the National Consumer Commission. I also want to welcome here in front with us Dr. Shenas El Halabi, who is the country representative of the World Health Organization here in South Africa. As I said, her scientist, Dr. Brown, is logged in from Geneva. We also have representatives from various state entities that were part of this work. Members of the media, you are welcome. Ladies and gentlemen, and fellow South Africans, good morning. Today is an important day as we commemorate the International Women's Day with the theme, Give to Gain. It is important and fitting that we have this briefing today on International Women's Day. I wish to start by apologizing for the Minister of Trade, Industry and Competition, Minister Pax Dau. He is an integral part of this event. Unfortunately, yesterday he left overseas. I spoke to him by phone and he's wished us well. He said we are also representing him. But as you also can see, the Minister of a very important stakeholder department in this regard, Minister Cindy Chikunga, is also overseas and is represented in this event by Deputy Minister Litsike. Minister Cindy Chikunga said if she can find a time where she is in the US, she'll also like to log in. I think she hasn't logged in yet, but we have got Deputy Minister Litsike, so we are complete. Thank you very much for attending this press conference, which I believe was long awaited by the country as a whole. I promised Parliament, because this matter was raised very sharply in Parliament, where they believe the state is doing nothing about an impending disaster that's going to befall women. I promised them that before the end of the week, we'll be having a press conference, and I believe we have kept our word. Now, let's start with the background. A study was conducted by the Department of Analytical Chemistry at the University of Free State and was published on the 25th of February, 2026. This study was conducted on 16 sanitary pads and 7 panty liners, which were bought online. In the study, small quantities of endocrine-disrupting chemicals, colloquially referred to as EDCs, were present in the tested samples. The study concluded that menstrual products are a significant but overlooked source of exposure to endocrine-disrupting chemicals. This story was picked up by the media and has received wide coverage, especially in social media, resulting in widespread panic amongst women and young girls who use these products on a regular basis. Now, what are these EDCs, or endocrine-disrupting chemicals? Endocrine-disrupting chemicals are natural or human-made products that have the potential to interfere with the action of hormones, especially reproductive and thyroid hormones, if the quantities exceed the permissible concentration levels. Hormones, on the other hand, are the body's chemical messengers produced by endocrine glands and are released into the bloodstream to regulate vital physiological process. They control metabolism. That means what you eat and what you take out and what you digest. They also control growth of a human being or any organism. They control reproduction. They also control mood and sleep and wake cycles. It's not spontaneous. You don't sleep and wake by a watch. There's an internal physiological process that does so. The watches are just helping us. Endocrine-disrupting chemicals are said to be capable of disrupting these very important bodily functions, which I've just mentioned. The permissible concentration levels of endocrine-disrupting chemicals in any product are determined by the cosmetic ingredient expert panel. This cosmetic ingredient expert panel is an international panel. They control whether the amounts of these disrupting agents are in concentrations that are harmful. Their decisions are usually used by relevant regulatory bodies, such as the Food and Drug Administration in the US, to set practice guidelines. There are many regulatory bodies in all our countries. That in our country is SAHPRA. The reason that I'm quoting the Food and Drug Administration is the biggest of them all over the world. You'll understand why. Because it's in the US. It has got more than 10,000 people who are sitting there every day for purpose of regulations. Yes. Now, where are these ECDs found? Where do we find them? Do we find them only on pads and panty liners? As earlier said, these are naturally occurring or human-made chemicals. Endocrine-disrupting substances can occur naturally, but it can also be made by human beings. Now, the most important takeaway message for today is that endocrine-disrupting chemicals are said to be ubiquitous in science. This is a very difficult word, difficult to pronounce. Ubiquitous. It means they are present, appearing, or found everywhere. Everywhere where there are human beings, these chemicals are ever present. They ever appear, and they are found everywhere. I want this message to be a take-home message because it's a very important message. They are ever present in low concentrations, in various foodstuffs, in household products, in personal care and beauty products, cosmetics, toothpaste, shampoo, conditioners, body lotions, lipsticks, which many of you are wearing today, clothing, which all of us are wearing, electronics, which many of you are carrying. They are widely used in agriculture as pesticides. The food we eat, one of the reasons that it has been able to produce is because we killed pets, and some of the chemicals used there are falling within this class of endocrine-disrupting chemicals. Now, is the finding of endocrine-disrupting chemicals in menstrual products a surprise or a new finding? That's the question. Is this finding a surprise or a new finding? Not at all. The findings of endocrine-disrupting chemicals were found in menstrual blood, it's not surprising to us at all. Previous published studies have confirmed that small amounts of these endocrine disruptors are present in menstrual health products. Have scientists always known about endocrine disrupting chemicals? That's the question. And have they also known that they are ever present in human life? Yes. The presence of endocrine disrupting substances have been known for over 100 years. And if I have to be precise, they were identified in the early 20s. So it means it's 106 years since that. A study in China reported that 40% of endocrine disrupting chemicals emanated from foodstuffs, 40% from other personal care products, as I mentioned, cosmetics and all that, and 18% from indoor dust, because these chemicals also are found widely in the soil. Of the personal care products, which we abbreviate as PCPs, which were analyzed, sanitary pads contributed 6.8% of the total exposure through feminine personal care products.
Recording in progress.
Now, what was the response by the state to the University of Free State study? Because quite a number of people, especially on social media, believe the state just went into hiding. Immediately after the study was released, the Department of Women, Youth and Persons with Disabilities, also the Department of Health, convened different meetings of experts to dissect this issue. You will appreciate that these are the departments that were directly affected. But from there, the two departments worked together to convene experts relevant to the study findings. The experts that were convened are divided into two clear groups in South Africa, but I might also add a third group, which is UN agencies. But here in South Africa, there were two groups. The first group are scientists, researchers, clinicians, and other health workers, those who work in the field of health. The second group are regulatory authorities and institutions. I've already mentioned here SAHPRA, National Consumer Commission, and many others who regulate everything we consume or we use. The United Nations agencies, viz., the World Health Organization, and the United Nations Population Fund, UNFPA, with their respective experts, also joined the meetings. I was not given the name of an expert from NFPA who could have joined, but I told you the expert from WHO, Dr. Richard Brown, responsible for chemicals and radiation at the WHO. I'm sure during the course of the meeting we'll know from UNFPA who has joined. Now, The meetings were attended as follows. Under the class of scientists, researchers, and clinicians, we had South African Medical Aid Council, South African Medical Research Council, South African Medical Research Council. I'm used to SANAC, South African Medical Research Council, represented by its president and CEO, Professor Ntobeko Ntusi, who is online, as I said. The National Health Laboratory Services, NHLS, which was represented in the meeting by its CEO, Dr. Boitumelo Simete, who is not around today and sent a rep, a representative. We had the National Institute for Occupational Health, NIOH. We had the South African Society of Obstetricians and Gynecology, SASOG, together with the South African Society of Reproductive Medicine and Gynecological Endoscopy. These were represented by Professor Ismail Borat and Professor Zozo Nene. Then, as I said, we have got the regulatory bodies, which I've already mentioned, but amongst them I forgot to mention National Regulator for Compulsory Specifications, or NRCS, and as I said, United Nations agencies in the form of World Health Organization and United Nations for Population Fund. This statement that I'm reading to you today is on behalf of all these bodies and institutions I've mentioned. It's not a speech by the Department of Health. It's a speech that was drafted jointly yesterday by all these bodies sitting together, some online, and I read the speech to them. So if I'm misrepresenting them, they are here, they'll be able to correct me, but I'm reading their speech. The meeting noted the following, which we wish to bring to the attention of the nation. Number one, that 20 publications have been produced over the years about endocrine-disrupting chemicals in sanitary pads. We had 20 publications already. That all the 20 studies have not demonstrated any inference of clinical harm to the people using these products. And again, they want us to repeat that endocrine disrupting chemicals are ubiquitous, found all over where human beings are. The exposure, also said we must tell you that the exposure of endocrine disrupting chemicals is actually higher in men than in women due to occupational exposure. I'm emphasizing this because the fear and the panic was about women, not men. But when you check, if you check physiologically in the blood of many people, people who are exposed to endocrine disrupting chemicals are men than women because of occupational exposure, as we saw with that study from China. But also, they said we must inform you that scientists are obliged to follow well-established scientific methods and protocols, and that scientists need to know and understand the avenue of reporting their findings. And also that globally, the industries that manufacture sanitary pads follow a universal approach in their manufacturing, and it's not unique to South Africa. And that potential risks of endocrine disrupting chemicals to disrupt hormones is still theoretical and not yet established in practice. That to establish potential risk needs certain amounts of the chemicals, and the relevant concentrations are determined, as I said earlier, by the Cosmetic Ingredient Expert Panel, which is an international body. That concentrations of EDC in menstrual products is very low. That findings of ECDs in sanitary pads does not automatically translate into harm in the human body, and that no link of clinical harm was established by the study that brought us here, and that in the absence of reliable data and small sample size studied, no harm to the general public can be said to have been proven. That also, that there were no clinicians, endocrinologists, or chemical pathologists that were involved in the study. These are special groups of people who, if there was any harm, are the first who could have detected it. The National Health Laboratory Services has not tested any human samples of endocrine-disrupting chemicals because no clinician has ever requested such from their clinical examination of any patient. So when we asked the National Health Laboratory Services what is their experience, they said no, they don't have any because nobody ever requested this from any clinical finding. This is important to note because when there was listeriosis, the first people who detected it, remember that disease which was found in Poland, the first people who detected it were doctors when they started getting patients. And they sent samples to the National Health Laboratory Services, whose institution, the NICD, the National Institute of Communicable Diseases, is an expert in this field. And they confirmed, when we phoned them, that doctors are phoning us in the national department. They are seeing something that they've not seen before. Have you detected it? They said, yes. We've already got quite a number of samples which are testing positive. So in this case, they say nothing was ever sent to them from any clinical examination. Also, that SAHPRA regards any product that aids a physiological function as a medical product. You are aware that SAHPRA used to be called the Medicine Regulatory Authority. The name changed to South African Health Products Regulatory Authority because it regulates all health products. Now they say one of their guiding principles is that any product that aids a physiological function is a medical product, which means pads, sanitary pads, because they are aiding a physiological product that happens in a female body, are medical products, which must be regulated by SAHPRA. But SAHPRA tells us that certain sanitary pads, while falling within this category, that aids physiological function, have been exempted by SAHPRA from regulation due to what they regarded as very low risk. They did not pick up any risk, and so they exempted them from ever being regulated like all the other medicines. You are aware SAHPRA regulate medicines by registering them, by monitoring side effects, and recalling them if they pick up anything. But in this case, they exempted them because people were asking where was SAHPRA. That from 2017, SAHPRA participated in an international study of low-risk medical equipment, and no evidence of causality was presented in those studies. That to date, no report of adverse effects due to the use of sanitary pads was presented to SAHPRA, and no need for regulation within SAHPRA was arrived at. That since the chemicals have been known globally for many years, the World Health Organization has been looking for any evidence of harm over all these years, but up to date, they never found any from these products. But we also know that the University of Free State study itself mentioned, I think in a press release, they mentioned that the study was not designed to establish a direct causal relationship between the detected chemicals and disease in women. Also that the research findings and their publications are not intended to constitute medical advice, so they are not advising anybody, consumer directive, or product usage recommendations. Rather, the study presented peer-reviewed scientific data and identify areas that researchers might need to look into further. That's what we're told the study did. So the research does not recommend that current products be withdrawn from the markets. And the NCC, National Consumer Commission, also reached a similar conclusion that from studies, including metrology, which they consulted, they reached a conclusion that there is nothing withdrawn. Now, the conclusion. World Health Organization is not aware of any cases globally where access to this important health product have been withdrawn because of concerns over health effects arising from endocrine-disrupting chemicals. Another conclusion is that endocrine-disrupting chemicals cannot be completely avoided or removed. That is a fact of life that must also be taken into consideration. Nobody can remove them and nobody can withdraw them completely. And that none of the tested products warrants withdrawal from the market. We've already said so. And that no evidence at present to support change of usual practice by users to these projects, to this product. Now, another conclusion is that regulators need to continue with their regulatory frameworks, surveillance, and consumer protection, as they've been doing all along. Nothing to change. They must just continue doing what they've been doing every day to make sure that me and you consume safe products. These regulatory authorities, as we said, is the South African Health Product Regulatory Authority, the South African Bureau of Standards, the National Regulator for Compulsory Specification, and the National Consumer Commission. We are saying in conclusion that we know they've been regulating what we consume. They must just continue. Nothing has changed. We are also saying the scientists must continue to research on these endocrine-disrupting chemicals, just as they've been doing for the past 106 years. I've already mentioned that it is 106 years that scientists have identified these chemicals and they've been researching them left, right, and center. They must just continue. Nothing changes. I think I've reached the end of the presentation. Thank you very much.
Thank you very much, Honorable Minister, for unpacking the statement as far as the government's response to the findings of the study conducted by the University of Free State. As Minister has indicated at the beginning that he's not representing the Department of Health, but is representing collective. So even when we come to questions, so feel free to direct questions to anyone, or look, the panel will decide, including the panel members who are joined virtually. You can see we've got about 4 panels, as Minister has indicated. SAHPRA is here, SASOC is here, and I forgot the third one. But otherwise, all the experts, WHO is here also in the room, but also virtually. So all the experts are here. Feel free to engage them. I believe we are also joined by other members of the media virtually. Can I have an indication if we've got any questions from the virtual platform?
Thanks, Pastor. So far, we don't have questions from virtual platforms. Thanks.
Okay, thank you. We will keep checking the space. So in the meantime, I'm going to allow colleagues who are from the media who are in the room. I want to emphasize colleagues from the media, in case there's anyone who's here who's not from the media, who's not from the media, just be reminded that this is a press conference. Only members of the media are allowed to interact with the panel, both who are here in person and virtually. So can we have an indication in terms of the hands from the media. As a practice, you raise your hand, tell us your name and the media house you come from. So let's see the hands. I see the hand at the back. Go on, your name and the media house. Oh, number one will be number one. Number two here, I think it's ENCA. Okay, maybe for now, let's take these two hands and yeah, go on. The first one. Your mic is not on. No, it must show some
There's a mic
red.
there in front.
Check the next, yeah.
A very good morning to everyone. My name is Sina Sipo from Business Day.
What?
Very good
Sini
morning.
Sipo from Business Day.
Yes. To the Minister, basically the number of the address today from the consultations that you had with the different bodies is that there is no need for immediate withdrawal of the products that which we sort of flagged in the research. The research does say that the ECDs that were found in those products are within the limits, but raise a concern that exposure over years is a concern. And it does also state that the ECDs are found in other products such as the food that we eat, raising the concern that it might lead to cancer or whatever, or the other illnesses that were cited there. Does the Minister or the panel accept that exposure over years to the ECDs does culminate in a concern in terms of contracting or in terms of cancer and all of that? That's my question. Thank you.
Okay, thank you. Let's get the second question.
Hi, Linda Basibata from ENCA. I'd like to know what engagements were had with the researchers of the university, and is the Minister saying that the researchers did not follow the correct protocol in reporting the findings of their study in terms of how it was disseminated? And I would like to hear from the panelists as well in terms of what does regulation look like moving forward. From my understanding, the message is basically there's nothing to worry about, but people are still worried. Just to come off the back of my the question from my colleague from Business Day, it seems overexposure over a longer period of time, and we've got girls who are as young as 12 who are using these products from a young age. So is there really no concern at all? Thank you.
Thank you very much. Any other question in the House on the visual platforms? Any update, Tagala?
Thanks, Foster. We now have 4 questions from Buhlali Muloi, who is representing Good Faith. And the first question is, does the dissemination of the University of Free State study via social media and news outlets imply that the presence of endocrine-disrupting chemicals in panty liners and menstrual hygiene products was misinterpreted, thereby inciting unwarranted public alarm? And the second one, what regulatory measures ensure that low-cost menstrual products sold in informal outlets contain EDC levels below thresholds, posing adverse reproductive and endocrine risks to females, especially in rural populations? And the third one, based on the university study highlighting EDC hazards in menstrual products, are there any specific brands slated for recall? The last one for now, amid ubiquitous EDC exposure from daily consumer goods and rising counterfeit products driven by economic pressures, what interventions mitigate cumulative EDC burdens exceeding safe chronic toxicity limits? Thanks.
Thank you very much. I think we have got enough questions for the first round of this interactive sessions. Minister will lead, then we'll assign others to other members of the panel.
I am going to try and answer, but quite a number of your questions are very scientific and technical. And then I'll rely to the scientists on board to answer them. But the issue of exposure over the years, especially in food, that is cause for concern. That's exactly what we have already said. That since 106 years ago, the World Health Organization has been busy checking whether these chemicals are causing any trouble. I've already said that in the speech, that the World Health Organization has been doing surveillance because of this potential theoretical threat. They've been checking whether it's coming to fruition for 106 years. That is why they've got a unit dealing with chemicals and radiation, whose head, Dr. Brown, is there. I'm going to ask him to say something about it, because you mentioned the issue of over the years. We're already having 100 years. Now, colleagues, I just want to add something, because, yes, people have got the right to be fearful. When scientists or studies show something that might put them in trouble, but I want to give you just an example about what is called potential harm. We have got a chemical called DDT, which is brutally effective against mosquitoes. But it's a chemical which the United Nations Environmental Programme has classified as a POPs, or persistent organic pollutant, meaning it's always in the soil, it doesn't go away, and there's potential. There have been studies done in lizards and all that, that it can disrupt reproductive systems. For that reason, DDT was banned under what is called the Stockholm Declaration, where United Nations Environmental Programme had a meeting in Stockholm in Sweden, and they declared that DDTs must be banned because of that reason. South Africa is one of the countries that stopped using DDT in 1996. It took 4 years for malaria to increase by 60%, just 4 years. And South Africa rushed to go back to use DDT. Namibia told me the same thing. The number of pregnant women and children under 5 who died because of that fear that DDT is a pollutant and cause trouble, because somebody put that study. That theory that DDT can kill started in 1960. It is 66 years now. I can show you graves caused by mosquitoes from malaria. Nobody has shown me a single grave caused by DDT. But they always say the ever, you know. Now, in Limpopo, in Vembe, Mopani, Itanzeni, in Mpumalanga, and Kanyagude in KZN, if you start spraying at least 90% of the houses at the borders with DDT, malarias go up immediately, even cerebral malaria. So much, we took this decision so much, that in 2013, myself and the then Minister of Health in Namibia, Dr. Kwame, and a professor who was the Minister of Health in Nigeria, we went to Abuja to heads of states and pleaded with them to take a resolution that South Africa cannot stop using DDT, despite what this persistent organic pollutant are. And the World Health Organization supported us, because we say people are dying, are going to die like flies. So the fact that there are studies that show potential harm does not necessarily translate into that harm. I just want to say that. But it doesn't mean that you don't do surveillance. DDT has been, the world has been doing, scientists have been doing surveillance since 1960. The same as this product. WHO and other scientists have been doing surveillance over a period of 106 years. So the fact that the study shows potential danger does not necessarily translate into that, but doesn't mean we fold our arms because we are saying long term, yes. In the long term, something might emerge, but not now. It has not yet emerged. Slindelo from ENCA says, did I say the scientists did not follow correct protocol? That's not for me. That's not for me. The institution that determines correct protocols for research, which is the prime research organization is health, is Medical Research Council. They don't control any other research. They control medical research. That is linked to medical issues. And I'll let them answer that question. You also said, what does regulation means moving forward? We just said regulators must continue their work. Butlali, the 4 questions that do I regard the leak of the study to social media as media misinformation? This study was put in a journal. And of course, the media picked it up from journal. I don't think anybody was misinforming anybody. I think the media that picked up this story, which also leaked into social media, were interpreting what they find in their own way and in their own understanding. What regulatory measures make sure that there are low amounts? I've already told you that there's an international body that is doing that work. That regulatory bodies all over the world take hint from. That body already exists, is doing the work every year. Are there any specific brands for recall? I've already said this study itself said they are not recommending any recall, and the scientists also. So nobody ever gave an indication or instruction that anything must be recalled. The issue of intervention of intervention of ECDs. I am not sure what the question read. Can somebody repeat for me? They said something about intervention, ECDs from toxicity.
It's exposure from daily consumer goods and rising counterfeit.
Oh, yes, exactly. That is why we have got regulators everywhere. We are aware of that. Remember, late last year, we in the Department of Health were invited by SAHPRA, WHO was also involved, launching a campaign to deal with counterfeit goods and false labeling. That campaign is there. WHO has got it. We became part of it last year because we know in this world the rise of counterfeit goods and false products is on the rise. So we didn't fold our arms. It's already there. There is surveillance every day, not just when something happened. Every day, you might not be aware of it because nothing happened. And when something happened, you may then believe they are starting now. No, it's been done every day because of fear of counterfeit goods and false products. Thank you very much. I will ask Professor Ntobeko Ntuzi to help with the first question. Prof, that the issue of exposure over the years, he will be followed by Dr. Brown from WHO. Prof. Ntuzi? I can see that.
Thank you very much, Minister. Are you able to hear me clearly?
Absolutely, we can.
Wonderful. So, Minister, I wish to emphasize 2 key points from your comprehensive statement. The first is that, as the Minister mentioned, these EDCs were described in the 1920s following the development of agricultural products that were also demonstrated to act as environmental pollutants. This was followed in the 1930s by the development of synthetic estrogen and other chemicals that could potentially impact human hormonal function. And since then, the concern has always been that hormones operate at extremely low concentrations and regulate critical biological processes. And therefore, a worry is that even at small exposures, these EDCs can have biological effects. But it is critical to emphasize that such clinical effects have not been demonstrated, and the concerns about the clinical effects of EDCs have not stood up to epidemiological scrutiny to date. Minister, before I answer the question, the second important point to emphasize is that since 2009, there have been about 20 publications, as you've mentioned, from all over the world, reporting on findings of very, very small concentrations of EDCs in sanitary pads and other female hygiene products. And similar to the study from the Free State, these studies have been led by analytical chemists who measure quantities using very sensitive equipment, but have not linked these measurements to clinical outcomes. Importantly, all of these have been small studies. They are observational in nature, most of them cross-sectional or retrospective in design, and so not designed to demonstrate causality between the measurement of these EDCs and clinical events. So to come to the question, the concerns, even on long-term exposure to EDCs, remain theoretical. And we have regulatory bodies in this country who are doing surveillance consistently, precisely to protect the South African public. And through their work, so far, there has been no signal of harm from these EDCs. And perhaps, Minister, before I close and hand over back to you, I may say something about the empirical approach, which is the foundational principle of the scientific method and how we demonstrate causality in medicine. This empiricism refers to the systematic acquisition of knowledge through observation, hypothesis generation, measurement, and experimentation, rather than theory, intuition, or authority alone. And in essence, empirical science relies on evidence derived from real world to test hypotheses and generate reliable knowledge that links an exposure to an outcome. And the typical research study designs that are needed to achieve this would be randomized control trials, cohort studies, case control studies, or laboratory experiments that are linked to clinical outcomes. And the goal of these is to generate reproducible data that can confirm or refute the hypothesis that there's a connection between an exposure and a clinical outcome. And the study we are discussing did not follow this vital tenet of medicine. And therefore, the finding of small quantities of EDTs in sanitary pads and panty liners have not been causally linked to any adverse clinical events. And indeed, there's been no adverse events or signal of harm demonstrated in any part of the world from the use of sanitary pads or panty liners following many decades of use. I'm going to stop there, Minister. Thank you.
Yeah, Dr. Brown from Geneva. The main question here is exposure over the years, especially that the ECDs are found in foods, and the fear here is cancer from business day. What is your response to that?
Thank you, Honourable Minister. I think the science around these chemicals has been very well described by yourself and by the colleagues. This is indeed a global issue and is extensively studied in many countries around the world, many regulatory authorities. And that science takes account of the fact that you can be exposed to these chemicals from many different sources, from personal care products, from food, from packaging, from female.
It's frozen.
And to emphasize what has been said by others, no harms from these types of products have been identified to date.
Right, those are live visuals coming in from government's briefing of the media on its response to the findings of a research study into chemicals detected in sanitary pads. The Minister of Health, Dr. Motsoaledi, says government has reviewed the study and is reassuring the public that there is currently no evidence that sanitary pad products on the market should be withdrawn at this stage. And among some of the key takeouts from the minister's briefing, the research identified that the presence of endocrine-disrupting chemicals, substances that can interfere with the body's hormonal system. However, Motsoaledi says these chemicals are widely present in modern environments and cannot be completely eliminated from everyday products. Now, for now, government says consumers should not panic, stressing that regulatory bodies remain in place to ensure that products sold in South Africa meet safety standards while further research continues.